This presentation focuses on the article from David Sum called Task Shifting the Management of Non-Communicable Diseases, and its insights from Kenya. In sub-Saharan Africa, the burden of non-communicable diseases is rising. And on top of that, there is a shortage of healthcare workers. And we're seeing that a lot recently with the migration of nurses from the global south to the global north. And so because of that, task shifting has emerged as a potential solution. Now, we've also seen migration with physicians, and so the resultant brain drain in African countries. And so this study looks at the effectiveness of shifting stable NCD management from clinical officers, which are physicians, to nurses in Kenya. So what is task shifting? Well, it's a process whereby specific tasks are moved where appropriate to less skilled healthcare workers. So this could mean from a physician to a nurse to a community health worker. And sometimes we see this in our hospital settings where we go through a process of delegation where nurses are delegated certain tasks. So it's kind of similar to task shifting. And the reason that this is done is to make more efficient use of the available human resources for health. And at one time, you could have said that maybe nurse practitioners were sort of like a task shifting from physicians until nurse practitioners had their own programs and their own exams. And so now they are their own entity. And the reason this is all done is to increase the capacity in situations where you don't have the available human resources, or to increase the capacity during times where training and retention programs are being expanded. And so we're focusing in here on low middle income countries. And so the research objectives for this paper were to assess the nurses' adherence to clinical protocols for NCD management, evaluate the effectiveness in managing 5 stable NCDs, so hypertension, diabetes, asthma, epilepsy, and sickle cell disease, and then to determine the feasibility of expanding task shifting for NCD care, maybe to other regions or other countries. The methodology was a retrospective review of clinical data and also data collected from 2 integrated primary healthcare facilities. And so these would have been facilities that probably had nurses and physicians working in both the facilities. And there was an analysis of the adherence to clinical protocols, patient screening, medication adjustments, and referrals. And the key findings were that nurses successfully adhered to clinical protocols in 69% of cases. Blood pressure and weight measurements were completed in over 89% of cases. Laboratory tests were reviewed in 91% of cases, and only 2% of consultations required referral back to the clinical officers or physician. And so the implications from this study and for healthcare systems is that task shifting can reduce the burden on clinical officers in resource-limited settings. Nurses can manage stable NCD cases effectively with structured guidance and supervision, and expanding this model could improve access to NCD care in low-income communities. And so the final conclusions were that this study supports the feasibility of task-shifting NCD management to trained nurses, and with proper training, supervision, and standardized protocols, task shifting can enhance healthcare delivery and address the growing burden of NCDs in low resource settings.